Parkinson disease management. We all know that Parkinson disease is the second most common neurodegenerative disorder in the worldwide, and Parkinson disease is due to deficiency of dopamine and neurodegeneration in the substantia nigra. And Parkinson disease is characterized by rigidity, tremor, bradykinesia, gait impairment, and other motor and non-motor manifestations. Non-motor manifestations like cognitive impairment and slurred speech, and anxiety, panic attack, etc. There are lots of cause of Parkinson's disease, like there are genetic causes, there are mutation in genes like Parkin genes, and other genes, and alpha synuclein involvement in this disorder is most important. And Parkinson's disease management is very complex, but the physician, clinician, the neurologist can manage this condition very well. And there might be comorbidities along with Parkinson's disease like diabetes, hypertension, and cardiovascular disorder, and other neurological disorders and respiratory disorder, etc. And that can be managed by the clinician very well. And Parkinson's disease has a complex mechanism. So there are lots of drugs used. Hello, not exclaim or hello. Okay. There are lots of drugs for the treatment of Parkinsonism like levodopa, carbidopa, and dopamine agonists like ropinirole, pramipexole, apomorphine, etc., and bromocriptine also, and other groups like MAO-B inhibitors like rasagiline, silagilin, etc., and COMT inhibitor, that is catechol-O-methyl transferase inhibitors, we can use like entacapone, but we cannot use tolcapone as it is banned due to hepatic toxicity. And another new drug is safinamide, we can use in Parkinsonism. And another NMDA antagonist like amantadine, 100 milligram, we can use once or twice daily. And anticholinergic drugs like trihexyphenidyl, we can use in drug-induced Parkinsonism or in other cases. And the side effect of trihexyphenidyl is dry mouth. We should be aware of the side effects of trihexyphenidyl. And we can use also apomorphine subcutaneous, or with the help of pump, subcutaneous pump, we can use apomorphine in case of severe cases. And it is a very good drug for on-off episodes that happens in Parkinson's patient in sometimes, but sometimes levodopa, after use of levodopa for a long period, that is 6 months, 6 years, or 6 months or 1 year, there might be less effectiveness of levodopa, and the honeymoon period of the patient can be gone, and the patient in the 6 months the patient's symptoms improve, but after 6 months or 1 year there might be reduced symptoms of the patient with levodopa, that is called wearing up, and in that cases we can use uh, we can do treatment reconciliation and give levodopa uh, with higher dose, or with levodopa carbidopa with higher dose, or we can change the we can give it frequently, twice or thrice daily, and also we can add dopamine agonists with it, like lopinol, pramipixole, etc. And we can also use MAVI inhibitors like selegiline, rasagiline, and NMD antagonists, amantadine, and also triaxiphenidil, etc. for the management of Parkinsonism. and Parkinsonism. Uh, the last option for the treatment of Parkinsonism is deep brain stimulation. Uh, because deep brain stimulation is an invasive procedure, and is the last resort. Is done in outside of this India and foreign countries. I don't know it is happening in India or not. Uh, so there is a question, not तुम्हारा कंटेंट क्या है? मेरा कंटेंट है पार्किंसनिज्म का ट्रीटमेंट। पार्किंसन पेशेंट जो है उसका ट्रीटमेंट कैसे होता है वो मैं बोलना चाहूँ। तो क्या क्या दवाई देते हैं, हाँ, क्या क्या यूज करते हैं दवाई, जैसे कि लिवोडोपा, कार्बिडोपा, रोपिनिरोल, प्राइमपेक्सोल, और बहुत सारा दवाई जो मैंने बोला वो सब यूज होता है। ओके, देन Parkinsonism, uh, we have to most careful for the patient, and the caregiver should give importance to the patient, and caregiver and the family members should care for the patient. There should not be any social stigma for this treatment of Parkinson's disease. and uh, and Parkinson's disease patients, in case of dementia, we can use memantine and donepezil, etc. For the management of cognitive impairment in case of Parkinson's disease patient. And if there are other anxiety, depression, then we can use also other anxiety, depression drugs like tricyclic antidepressants and other SSRIs we can use in this case for the management of anxiety and depression in case of Parkinson's disease. But we have to remember about the serotonin syndrome during the management, as serotonin syndrome can occur if you give uh, SSRIs along with other drugs that there is drug interaction, and it can cause serotonin syndrome. In that case, uh, we have to be more cautious in using these drugs. We should be cautious about the drug interactions in this Parkinson disease management, because lots of drugs to be given in this case for the management, there might be need of lots of drugs. That's why drug interaction and adverse drug reaction, we have to be cautious about this, and we have to counsel the patient about these drug interactions and adverse drug reactions. And we should report if any adverse drug reactions to ADR monitoring center nearby, and that will go to the WHO UMC for WHO UMC causality assessment. and in this way the Parkinson's disease can be managed very well, and uh, and there is a need of treatment reconciliation by clinical pharmacologists or the neurologists, they can do treatment reconciliation for the betterment of the Parkinson patient, and the effectiveness of the drugs can be uh, known by using the MDS UPDRS, Movement Disorder Society Unified Parkinson Disease Rating Scale, and also the quality of life can be assessed by PDQ 39, the Parkinson disease quality of life 39 questionnaire, and also WHO BREF questionnaire. We can find out the quality of life of such patients, Parkinson disease patients, and whether the Parkinson disease patients are improving or not. And medication adherence is an important thing in this case, Parkinson disease, and we should counsel the patient to take the medicine regularly, and medication adherence score can be find out by the Mars scale or Morisky scale, and according to that, the patient has to be counseled for taking medicines properly, so that medication adherence will be good, and the patient will be improved in quickly, and the quality of life of such patients can be improved. So neurologists and other physical medicine rehabilitation and clinical pharmacologists and other departments have to do a coordinate coordinating way, uh, should manage the patient, so that it will be very helpful for the patient and the society. Thank you for very much listening and watching me, and I have to leave now because I have some work to do now. So that's all for today. Please like and subscribe my channel and watch my videos, and so that you can get a lot of knowledge, and you can learn most of the diseases and drugs used in management of different diseases. You can know from my videos, and please like and subscribe, and I will meet you again in a different day. So thank you very much. जय जगन्नाथ. धन्यवाद.